Hey, this is Doug Fields, CEO of Institute for Healthcare Consumerism, along with my co-host Brent Macy, Managing Director, and welcome back to the segment of Healthcare Consumerism Radio. We're real excited to join one of the leaders, have one of the leaders in the whole health advocacy space join us today. And on the phone with us today is one of the co-founders of HealthAdvocate, Marty Rosen. Marty, good morning.
Good morning, Doug and Brent.
How are you doing, Marty?
I'm great. There's a lot of sunshine here outside of Philadelphia. How about you?
We're doing great. I was a little late to the program today. Welcome to Atlanta traffic. You never know down here, but we're here. Marty, for our audience, give them a brief backgrounder on Health Advocate. We followed you for quite some time, but give our audience a brief backgrounder.
Sure. My partners and I founded Health Advocate about 14 years ago. From scratch, literally 5 of us started with an idea and a concept, and with a lot of great people and a lot of good fortune, we've become the largest health advocacy and assistance company in the country. We have more than 10,000 clients today, and 2 other notable things. We've now, beyond advocacy over the last 6+ years, offer a number of other integrated products and solutions, including wellness coaching, employee assistance, chronic care solutions, data analytics. And then secondly, we were just recently acquired, which we're extremely excited about, by the West Corporation, that is a worldwide leader in technology-driven communications. And the acquisition closed at the middle of June, and we feel quite fortunate to be part of a company that has such a great customer record as well.
Yeah, I think, Marty, congratulations, first of all, on that. I think it's there's been a lot of mergers, a lot of acquisitions going on in this space from some big players that are not necessarily in healthcare, and I think that's not only a testament to what you folks have done and are doing, but it's a testament of where we see this whole space moving right now.
Thank you.
Yeah. So, you were way ahead of the curve 14 years ago. I mean, it feels like the seat I was in 2006 when I looked at this market and said healthcare consumerism is a real emerging megatrend, and people looked at me and said, "You're nuts." So, but very astute. And you and I got to stop for a minute and take a second. You and I go back a ways. You probably don't recall. I know you back in your U.S. healthcare days. I actually founded and ran the whole EBN news group, and so we've been in this business together a long time.
You bet, and the circle of people that have been part of this evolution. It's really fascinating, that we continue to talk and run into each other.
You bet. Listen, talk specifically about Empowered Health, your new program. I think it's very interesting about the integration.
Sure. I think what led us to the conclusion from our background and experience to develop Empowered Health, as well as the we started working on it more than 2 years ago and took an incredible effort to put it together. But we realized that the healthcare consumer and their plan sponsor, the employer, were really facing a fragmented world when you think about it. No single 800 number. On average, many companies have at least 7+ vendors. The employee and the family member have to call multiple different vendors, different 800 numbers. I mean, they need a separate wallet for all the wallet cards, if you will, or the keychain is heavier by all these key fobs. And when you're speaking to one and you have another issue at the same time, that particular vendor can't help you, obviously, because you call for the narrow issue that they might have been focusing on. So, in effect, the system is built around silos. But that's not how human beings, really respond. And what we realized was, wouldn't it make sense to create an integrated model which would obviously have a single 800 number that would promote unified reporting for the employer, not having reports from different vendors, if you will, eliminate employee confusion of who to call, certainly reduce the redundancy of costs, and most importantly, just improve the overall engagement and the healthcare experience, and consequently the outcomes to help to reduce costs and improve the healthcare experience. So with that set of premises, we built the model of Empowered Health. Very simply put, it has certain very important characteristics. I mentioned one already, a single 800 number. That is absolutely critical, that you're not having to call multiple numbers. Also, part and parcel of Empowered Health is the notion of an integrated team. So we built a special innovation center, and at that innovation center we have the personal health advocate, we have a wellness coaching team, employee assistant counselors, licensed psychologists, medical directors. They literally all sit in one area. That's also further supported by a very sophisticated technology system. We like to think of ourselves as both high-tech and high-touch. And that integrated system allows us to take the person's call, to be able to organize it in an integrated fashion. Now, the model of Empowered Health, we start out with being able to package in one solution advocacy, wellness coaching, employee assistance, work life, chronic care solutions, nurse line. We have a very sophisticated personalized health communication system to notify and to enhance employee or member engagement. So those special features, think about as one integrated system, contrasted to the current world of a lot of fragmentation. Let me give you an example, which I think is poignant in terms of the value of this. Somebody is calling, for example, about a billing issue. There's a question about a bill or an insurance claim. Well, interestingly, underlying that bill or claim is a clinical issue. They might have at the same time the need to speak to a nurse or a doctor about their clinical issue, or they might at the same time realize that they're having a problem making an appointment with a hard-to-reach specialist. So rather than having to call a second time or somebody else, they're able to talk to one person at that time who's able to deal with these multiple issues. And we think that just from the customer experience perspective, this model is really the state of the future.
Now, Marty, can you offer means of connectivity via the phone, via the internet too, through a technology platform as well? I mean, is it?
We do, and we think that it's really important to offer access points that are convenient to the consumer, not convenient necessarily to us, but convenient to our member. So, for example, they'll always have the option of calling, speaking to a personal health advocate or wellness coach. They have the option of having their own personalized web site that's personal to them and all HIPAA-protected information that pertains to them. We have developed mobile apps to be able to access not only their range of solutions that we've talked about, but we've also made a big investment in pricing transparency. So on that app or on the website, or they could call us, we provide information about costs for doctors, hospitals, around different procedures, around different settings, inpatient, outpatient, ambulatory care, et cetera, et cetera. And we also have texting options available around wellness coaching as well. So again, we think that it's really important to be at the right place at the right time to help that individual.
Marty, one of the things that we're seeing in the marketplace, I mean, healthcare consumerism is taking its grasp on the market, and employers are adopting it. Where do you see, this integrated type approach fitting in the whole healthcare consumerism industry?
Well, I think it is in many ways going to be the future. And the reason I say that is that in terms of the fragmentation I described, I'll mention two things, or highlight two additional things. One is the cost issue. The package we've put together, and I could give you the price for a group of 1,000 or more employees for that entire package of components is $7.85 per employee per month. Now, we've done studies and compared it to what is available on an a la carte basis in the marketplace. We're talking 2 to 3 times as expensive. And the reason we're able to do it less expensively is we're eliminating all of the administrative redundancy. So think about 7+ programs. There's overhead for each of those programs times the number of programs. So that's one issue. The second issue is probably even more important, leading to even more cost savings, is the role of engagement. And through this model, we're talking through that single 800 number to most of the people most of the time, as opposed to a more fragmented approach amongst different vendors. And we think at the heart of what's going on in the country, which is a transformative period for a lot of reasons, employers, and we hear it directly from them, that the simplicity, the elegance of this integrated model makes an awful lot of sense. I would also add that one of the reasons we did this, we didn't sit in an ivory tower, quite frankly. We listened to our customers. Our customers have been telling us this for years. And even though Empowered Health, has been rolled out about a year and a half, we've been working on it well before. We had a lot of experience over probably the last 8 years because we sold before that bundled program. So, for example, we sold advocacy and wellness together, or advocacy, wellness, and the EAP together. So we started to realize that this integration had even more traction to it by bringing these other pieces together. And I would, again, tell you, related to the technology side, to do this is no small feat.
No, I think that's right, Marty.
Proprietary, state-of-the-art CRM system, a fancy term for an infrastructure that allows us to integrate data when the calls come in, to seamlessly handle those calls across the multiple platform of programs. And also, I would emphasize, especially for employers, the notion of integrated reporting, that they could literally see across these different categories. We capture data on all aspects of what we do, not only on the call, but following the call, behind the scenes, in working to resolving issues.